Today, I want you to close your eyes and imagine that you're going into a deep sleep. You're having the most vivid dream that you've had in a while, and all of a sudden you wake up, but something's very different. You are completely paralyzed. You can't move. You want to scream, but you can't, and you feel as if something or someone is choking or suffocating you, and you see this figure standing next to your bedside, and you are terrified. Well, today, guys, we're going to talk about sleep paralysis, and I've suffered from this disorder since I was 7, and I still do to this day. So we are going to discuss or talk about what sleep paralysis is, what are the signs and symptoms, what causes sleep paralysis, and how is it diagnosed and treated. Before I begin, I would like to cite some of my references from Your MD, an article called No Sleepless Nights by Ethan Green, sleepeducation.org, and the International Journal of Basic and Medical Research. So, sleep paralysis. Sleep paralysis is a sleep disorder that temporarily paralyzes your body and disables your ability to speak. An individual that will suffer from this usually happens when they wake up or fall asleep. It can happen to anyone that is healthy, but it has been linked to people that may have a genetic predisposition. It may sound frightening at first, but it is harmless. According to Ethan Green, he wrote an article called Sleep Paralysis Stories, Demons, or Hallucinations, and he conducted a poll so that he can gain a considerable amount of information regarding those who suffer from sleep paralysis. One of his polls had asked, how often do you suffer from sleep paralysis? Many of those people that have voted have said that they have experienced this at least twice or 10 times in their lifetime. Others have said that they have not experienced it. Some had said maybe once in their life, and a couple others probably periodically within a couple of months. The second poll that he conducted was, how do you stop sleep paralysis? And many of those had gravitated towards prayer. Others have said that they are or try to move, they try to remain calm, they try to scream for help, and some say they've tried to fight it. According to the American Academy of Sleep Medicine, they state that, and I quote, sleep paralysis tends to first appear in the teen years. It then occurs most often when you are 20 or 30 years old. So now that we understand now that we understand what sleep paralysis is, let's talk about the signs and symptoms of sleep paralysis. The signs of sleep paralysis are very notable. You are paralyzed and you're unable to move or speak. Some people have associated sleep paralysis with visual or auditory hallucinations. Some have said that they felt a demonic presence pressing on their chest, making it difficult for them to breathe. And others have stated that they've seen a shadow-like figure standing right beside them at their bedside. Some people have heard noises such as hissing or buzzing sounds, humming sounds, to name a few. And some people that have actually experienced sleep paralysis will say that it has lasted from 2 seconds up to a couple of minutes. Now, when they get out of this sleep paralysis phase, they will become groggy or tired, frightened, or even panicky on some occasions. So we talked about the signs and symptoms. What are the actual causes? So the cause of sleep paralysis is unknown. However, it is associated with REM sleep, or rapid eye movement for short. So during REM sleep, our body tends to relax. Our brain tells our body to relax, our muscles to become paralyzed, because in REM sleep, this is where our dreams happen, and our brain prevents our bodies from acting out our dreams, and that is the reason why we're paralyzed. For those who suffer from sleep paralysis, tend to wake up during the REM phase. Therefore, there's a reason why we're paralyzed, and it's because our brain is awake, we're conscious of our surroundings, but our body is still asleep, and that is the reason why we're paralyzed. According to the International Journal of Applied and Basic Medical Research, it says that spells of sleep paralysis have been associated with narcolepsy, seizure disorders, and hypertension. All other associated disorders could be linked to PTSD, anxiety, stress, and insomnia, to include jet lag. So how do we diagnose and treat paralysis, sleep paralysis? As far as diagnosing is concerned, it's best to speak with your medical provider. He will probably suggest that you conduct a sleep study so that he can observe your sleep patterns. He will then ask for your family and your medical history to see if there is a genetic inheritance. As far as treatment is concerned, based on your associated triggers with sleep paralysis, you will probably receive medication. And if not, he or she will tell you to take less naps, suggest that you get at least 6 to 8 hours of sleep. So we discussed what sleep paralysis is. We talked about the signs and symptoms of sleep paralysis, what are the causes, and how it's diagnosed and treated. Based on my research and my experience, I can only say, and I would advise that you relax when you're having this episode or spell. Try not to overthink it and find ways to cope with it, whether it be mentally or seeking a medical provider that can offer some assistance so that you don't feel as if you're not getting the help you need. I hope you learned something new today. I hope it gave you a peace of mind. Thank you so much for watching, guys.